Hey everyone, so today we're going to be performing a bunch of inhibitor techniques for patients with hemiplegia. So our first technique is what we call the gentle shaking. So you let the patient lie on his back while you position yourself above the top of the head of the patient. So this technique is a combination of light joint compression and traction to provide segmental relaxation. This technique is for patients with hemiplegia to alleviate pain and temporary muscle imbalance. You will not apply this technique to patients with limited levels of arousal. You will be placing your right hand below the occiput of the patient. Slowly flex the neck of the patient, and then you're going to be applying you're going to be using your left hand on top of the head of the patient to apply slight joint compressions on the cervical area. Now, while doing this position, you're going to slowly circumduct the head of the patient while applying light joint compressions on the cervical area, and as well as applying slight tractions. So we'll be repeating this for 5 repetitions. In a side lying position, you're going to be slowly rolling the patient from side lying all the way to prone position, meaning you're going to be letting the patient face towards the bed. So his face would plant on the bed. So let's start with the procedure. So first, you're going to be using your one hand on top of the patient's hips and the other hand on top of the patient's shoulder, so that you can rock the patient or you can roll over the patient. Now, instruct the patient that you're going to start the movement and then commence. So you're going to be doing this for 3 to 5 repetitions. Also, there's one thing that I would like to add. You would let the patient flex his or her arms all the way up so that the patient would not find any difficulty rolling over. So for our next technique is what we call the neutral warmth technique. So you're going to be positioning the patient in a supine position, meaning you have to let the patient lie on his back while you position yourself at the side of the patient. So we're doing this technique to affect the temperature receptors of the hypothalamus to stimulate the parasympathetic nervous system. So we're performing this on patients with hypertonia, particularly spasticity and rigidity, multiple sclerosis, cerebral palsy, Parkinson's disease, and secondary to stroke. So contraindications for this is excessive warmth because it may produce increased arousal or tone and possible seizure in pediatrics. Okay, so in a lying position, you would wrap your patient with a fleece blanket or a down comforter. This would keep a neutral warmth within the body. Now, you would want to apply this for 5 to 10 minutes. So in our situation, I don't have those materials, but in a real life situation, you would need those materials. This technique is called the slow stroking technique. So you're going to be positioning the patient so that he would lie on his belly. So you would position the patient in a prone position while you stay on the side of the patient. So we're doing this to produce a calming effect on the autonomic nervous system, and so that we could decrease muscle tone. So we're applying this to patients with hypertonia, multiple sclerosis, cerebral palsy, Parkinson's disease, and secondary to stroke. So contraindications for this should not exceed 3 minutes. You're going to be placing both of your thumbs on opposite ends of the spinous processes. So afterwards, you're going to be slowly stroking your thumbs all the way to the middle. So you can also opt with your fingers. So from both ends gihapon and all the way to the center. So you're going to be performing this for 3 to 5 repetitions. This is to stimulate your parasympathetic nervous system. So from this end, you're going to be moving it downwards, and from this end, you're going to be moving it all the way upwards. In this technique, we're going to be positioning the patient in a sitting position while you stay beside the patient. So the reason behind this is that the pressure that you apply on top of the tendon inhibits the muscle through the Pacinian corpuscle located under it. So intrinsic flexors of the hand may be inhibited by applying constant pressure over the entire length of the tendon. So the indications for this is for patients with spasticity, multiple sclerosis, cerebral palsy, Parkinson's disease, and secondary to stroke. So this is contraindicated in the sustained positioning because it may dampen muscle contraction and affect functional performance. Okay, so in a sitting position, you're going to be handing the patient's arm, the affected arm, and then you're going to support it with your one arm. And then with your other hand, you're going to be finding or palpating the biceps tendon. Then afterwards, you're going to be applying pressure on top of it. You're going to be holding this pressure for 20 seconds. So assuming that will be 20 seconds, and that is your joint pressure. So the next technique is what we call the light joint compression technique. So you're going to be positioning the patient in a short sitting position while you stay on the side of the patient. So the explanation behind this technique is we're going to be inhibiting the spastic muscles, relieve shoulder pain due to spastic muscle, and to offset temporarily the muscle imbalance around the shoulder joint by applying a force on the elbow and all the way to the glenohumeral joint. So the indications for this would be for hemiplegic patients, multiple sclerosis, cerebral palsy, Parkinson's disease, and secondary to stroke. Contraindications for this one would be inflamed joints. Raise his shoulder and bend his elbow at a 35 to 45 degrees. So after doing that, you will be applying a joint compression towards the glenoid fossa of the patient. And you'll be repeating this for 3 to 5 reps as well. So just apply a compression. So your force will be all the way to that side. So the next technique is what we call the maintained stretch technique. Position the patient in a supine position, and then you're going to be staying near the patient. So the reason behind this is that positioning the patient in that position and letting the patient's affected arm hang on the side of the bed elongates the muscle, causing the muscle spindle to react and get used to the lengthened position. So to make it less sensitive. So indications for this would be patients with multiple sclerosis, with cerebral palsy, Parkinson's disease, and secondary to stroke. So contraindications for this would be flaccid muscle belly. I'll be instructing the patient to hang on the side of the bed, the hand rather. So you will let the arm hang. It makes sure it is the affected arm. Okay. So you are going to be instructing the patient to hold this for 20 seconds to accommodate the muscles and eventually let it relax. Okay, after positioning the patient in an all-four position, you're going to be shifting the weight forward and backward, side to side, and in a diagonal pattern. So this would be in a progressive manner. So handling it would require you putting your hands on the hip of the patient, and you're going to start the movement. So you're gonna rock back and forth, side to side, and in a diagonal pattern. So you're going to be instructing the patient to try to balance his or herself. Okay, so for this technique, you would require your patient to either prone, supine, or short sitting, depending on the muscle that you are going to inhibit. So this is a case-to-case basis, but for demonstration's sake, our case would be to inhibit the quadriceps muscle. Now, for prolonged icing, we're going to be applying a cold pack. Actually, this is a cold pack over the muscle for 20 minutes. So, presumably or ideally, we would want the cold pack to be around 10 degrees Celsius or 50 degrees Fahrenheit. So, yes. So in our case, the patient could be in a short sitting position. So let's apply it on the quadriceps muscle. Or you can let the patient do it in a supine position so that he can be more relaxed.